What is mandibular tori? How can we diagnose it and what to do about it? Most of the time, your dentist or your hygienist will point out to a bony growth inside your jawbone right by the tongue side and they tell you that you have a mandibular tori. And then you look at them and say, okay, what should I do about it? But most of the time, you don't have to do anything because it is a benign bone growth and most of the time they are small in size. The only time that you have to consider doing something is when they get larger and larger in size. And then the only option is to surgically remove them. And the reason why the surgery will be recommended then, because they will start collecting food, you will have bruises on top of them because the skin is so thin, they will affect your speech, and most importantly, they will affect your sleep. Because of their large size, they will push your tongue to the back, so you'll have a retruded tongue position, and most patients who have large tori, they will tell me that they have sleep apnea. And then that's where we go ahead and we'll prescribe surgery. So let's talk about what we do in preparations for surgery to remove those large mandibular tori. The first thing we do after clinical exam is to take an in-office dental CT scan.
And from the dental CT, we can evaluate how big and how intrusive the tori is. And also it can help us provide a map and the best surgery to remove the tori. So in this situation, for example, when we go up and down on the CT, you'll see that the right and the left tori actually almost touches each other. And this will show you how big these tori are and why we need to remove them. But from there, I can say, okay, I'm gonna go ahead and start the cut from the back of the canine. I can go all the way to the first of the molar. I know exactly the length of my cuts and how deep they will be, and that will ensure that the surgery will be more accurate and help the patients with faster recovery and with minimum amount of complication.
By looking at how wide is the base, we can decide on the best surgery to utilize. I don't like to use high speed or burrs to cut the tori because that increases the risk of air embolism. I prefer to use piezosurgery, and that is bone cutting by ultrasound. I usually recommend the use of the piezosurgery over the conventional high-speed instruments because of the safety that the piezosurgery have. It works with ultrasound, so you can only cut the bone, and that will preserve the soft tissue and the structures around it. Then after the tori are removed and we close the surgery, we place a few stitches. And then we tell the patients to go through a liquid diet for the first day and soft diet for a week after. We'll take the stitches out in a week. Usually the recovery do not require antibiotic, and most of the time patients can do well with over-the-counter pain medication. So don't be scared if you have to go through mandibular tori removal. Surgery is simple as long as it's done by expert hands. Hopefully we gave you enough information about the mandibular tori. If you still have any question, please go to our website or give us a call at 301-652-9505 and we'll be happy to set up a complimentary consultation.